Hi everyone, my name is Dr. Chisako and I am from Build Strong Pelvic Health and Physical Therapy. Today I'm here to talk to you about the importance of pelvic floor physical therapy for both men and women. Now, traditionally, a lot of women start to get pelvic floor physical therapy postpartum while they're pregnant. However, a lot more women are starting to get pelvic floor physical therapy all throughout their lifespan. Whether you are younger in your teens or whether you are matured into perimenopause and menopausal age. So this is a lifespan of a treatment, meaning that depending on what your situation is, pelvic floor PT can absolutely help you in all stages of life. Now, pregnancy and postpartum times are typically the times that a lot of people seek out for pelvic floor physical therapy because we just went through a lot of changes. You just carried a baby for almost 10 months. You had potentially a C-section, potentially a vaginal delivery, and with or without a tear, chances are a lot of things happened. So with that, sometimes we get urinary incontinence right after postpartum. Sometimes we have pain where these stitches are after you give birth. Sometimes things just feel really irritated and dry. Now, those are all things that we can definitely address during pelvic floor PT with a proper assessment. And additionally too, we can also treat you during pregnancy. So during pregnancy, there are a few indications that you may need pelvic floor PT, and that could be very similar to when you are postpartum. So you may have low back pain, you may have heard of lightning crotch, you may have heard of round ligament pain. All of those symptoms very common during pregnancy, and with proper pelvic floor PT, we can help you alleviate some of these symptoms for a much comfortable pregnancy. So, not only do women need pelvic floor PT, but men also need pelvic floor PT because very similarly, they also have a pelvis and they also have pelvic floor muscles. Now, a lot of men may not complain initially about leakage and dribbling. However, many men still do. So men anatomically have two sphincters compared to women when we have only one sphincter. So there's a chance that men may not realize that they are leaking as quickly as women are. So a few other reasons why males may need pelvic floor PT is because they had any kind of issues with their prostate or even prostate cancer, or even a prostatectomy, which is basically when they take out your prostate surgically. A lot of times, urinary incontinence as well as sexual dysfunctions may happen post-surgery. So that is where we step in and make sure that you are able to go to the bathroom by yourself and you are able to fully function afterwards without any difficulties. Now, pelvic floor PT may feel daunting and it may feel like there's a lot of things that come about it. However, the quicker you address a lot of these symptoms, the better you'll feel. So, when in doubt, definitely seek out a skilled pelvic floor physical therapist near you, and let's try to make sure that we get you stronger and healthier. Thanks.